I am here with Alexandra Tamas, the Director of Public Affairs at FPA, European Federation for Pharmaceutical Industry Associations. Thank you, Alexandra, for being with us. We're very happy that you agreed to give us this interview. So maybe I'll just first ask you about your experience at this conference, because I know you actually are a young Gasteiner yourself in the past. So how does it feel to be here? And can you reflect a bit on your experience, maybe?
Thank you so much for inviting me to have this interview. I'm really happy to be back in Gastein, sharing and participating at the conference as a representative of the pharmaceutical industry operating in Europe. I've participated in the Gastein Forum twice before, as you mentioned, as a young Gasteiner, in 2020 and 2019. And at the time I was representing an NGO working on health promotion and tobacco control, and then the second time I was representing the Ministry of Health of Romania. So I really have different perspectives joining this conference, but I come with the same good spirit of meeting people, just joining the debate, being open-minded, and building a network that then will be able to use in my professional but also personal experience.
Sounds great, and I think very relatable to a lot of young Gasteiners. So today you were having a session on access to novel medicines in WHO Europe region, and you were talking about this Oslo Medicines Initiative. Could you maybe tell us a bit about your expectations for this initiative, and how do you think it can improve access, and how particularly do you see the industry taking role in that?
As an industry, we really welcome the Oslo Medicines Initiative, actually the initiative that is now being driven by the WHO Europe office, and really involving all stakeholders. We were very happy to participate in all the expert panels and the conversations all throughout these 2 years since it has been launched. Even our highest level CEOs have been participating in the meeting in Tel Aviv, so we're really happy to be able to contribute with expertise and our perspective to really push forward this topic. It's an important one. Access to medicines, indeed, we see it with FPA data. It is unequal, but it's also a very complex issue that needs all stakeholders around the room to propose solutions. From the industry side, we have a couple of actions, concrete examples of solutions that we have already put forward on the table, and are really keen to see other stakeholders endorsing them and then taking them forward, implementing them. It is going to be an important but also interesting and work ahead, because it will require endorsement, trust between stakeholders, but also policy change, legislative change. So when it comes to, for example, amending policies around access and pricing, it does require the consensus of all parties.
Yeah, a lot of political will there. Thank you for that answer. And perhaps going from the Oslo Initiative into this general EU Health Union plan, we all find it very interesting. I think everyone is quite excited about that, at least at this conference. So I'm wondering, how do you see the role of industry in supporting this plan, and what's your expectation for it? Yeah.
The European Health Union is a very exciting initiative, but also a very complex one. So it has a lot of implications, but we've never been in a better moment than we are today after COVID, and in the midst of a conflict and an energy crisis and an economic crisis, maybe, to really think about solidarity in Europe, about equity, and how do we ensure that no one is left behind, like we've been hearing all throughout this conference. So the European Health Union, it's an ambitious project. We are very happy to see it being a flagship the President of the Commission, and a few of the proposals already being presented, like the European Health Data Space, which is part of the European Health Union, or initiatives around cancer, beating cancer plan. And then the last maybe missing piece is now the pharmaceutical strategy and the pharmaceutical legislation, and that will really complement the European Health Union. And for that, we are very willing to contribute, very happy to contribute and share our perspectives, because it will require a change in mindset. Do we really allow the European Union to discuss health matters?
Yes, indeed. On that note, I actually just have one last very short question to you, and that is on a more personal note, I would say. Perhaps if you could in one sentence summarize what for you is your mission in the coming year in terms of health. What is your health mission, let me put it that way?
Mm-hmm. So I am privileged, I would say, in a privileged place to be working in Brussels, but my mind is always in my home country, Romania. So how do we bridge the gap? How do we close the gap between Western Europe and Central Eastern Europe when it comes to healthcare services and access to medicines? Because we do see different needs in these countries and in the region. And how do we make sure that every country and patients throughout the region really have access to the medicines that they need, to the healthcare services that they need when they need them. So I think just looking at the data, in Romania there is a lot of preventable disease, disease that could be preventable death that could be avoided by using the medicines and the treatments and the technologies that are available, and that gap must be closed.
So it's about bridging the gaps and inequalities across Europe. Thank you, that's I think very important, and with that I'd like to wrap up our interview, and thank you very much. It was a pleasure talking to you.
My pleasure as well, thank you.
Thank you.